Hello, everyone, and welcome to today's webinar brought to you by DHI, Digital Health Insights, and Healthcare Triangle. Today's webinar is unlocking the power of AI, generative AI, and data modernization in healthcare document processing. A few notes before we begin. I'm Steve Myers, Managing Editor for DHI, and I'll moderate today's session. We'll have a main presentation followed by some Q&A as time allows. You will see a Q&A function on your dashboard, your webinar dashboard. Feel free at any time to use that and submit a question. We'll gather up the questions and we'll get to as many as we can at the end after the presentation. So today's webinar is being recorded. This will allow you to view it on demand as needed. If you have to step away, you miss a portion, or for whatever reason, you want to dive back in and get a detail you might have missed, this will be available on demand shortly after we wrap up the webinar today. So look forward to being able to view that as many times as you would like. And now I would like to introduce our speaker for today. Damian David is Senior Director of Sales and Business Development for Healthcare Triangle. In his 23 plus years in healthcare IT, Damian has helped hundreds of hospitals and healthcare organizations successfully adopt various technologies, from EHRs to secure cloud solutions, including things like infrastructure, storage, processing, and of course, AI and machine learning, natural language processing. In his many different roles in healthcare IT over the years, he's helped his clients attain their desired outcomes by fusing technology and healthcare effectively and appropriately. This approach has led to increased client performance, client satisfaction, and market share. So now I'd like to hand things over to Damian, and he'll take us through today's presentation. They're all yours, Damian.
Steve, thank you very much. Appreciate the opportunity here to speak with everybody. Hope everybody's having a good kickoff to what will be a wonderful holiday season for everyone. And yeah, so I wanted to spend some time and share with you all a little bit of flavor around how we're helping some clients gain some efficiencies with what they're doing in operations on the healthcare information side, as well as broaching a couple of popular topics in hospitals and healthcare over the last year or so. So I've had the privilege of attending, participating, even presenting at various different national conferences and regional conferences throughout this year. And it seems as though a lot of the conversations fall underneath some of the common categories of staffing resource challenges, trying to do more with less overall as an organization, ransomware, cybersecurity challenges. It seems on almost a daily or weekly basis, people are trying to get at some of the data information that we're trying to not only utilize, but also effectively protect on the back end as well. In actual digital modernization versus just talking about it, I think, since our meaningful use 2011, 2012, everybody's been investing a lot of dollars, time, and energies into getting to that digital modernization process and promise that we've been talking about for over a decade now. So really making that a reality is a lot of the conversation that I've heard lately. Effective utilization of some of the tools and solutions they already have in place. I think burden, burnout, exhaustion amongst not just what was physician focused maybe 4 or 5 years ago, but the full circle, right? Everybody in the organization, it seems as though since we got hit with the COVID experience, it's been trying to ensure that people are moving forward and they have the energy to do so. And then lastly, it seems like everybody's favorite topic, whether they like it or whether they're afraid of it or whether they see promise in it or they think it's a flash in the pan trend. And I've had all those conversations, is around artificial intelligence, probably most specifically around generative artificial intelligence this year. Though, you can't get into that conversation without AI and machine learning and NLP and LLMs in general, right? So I thought it was interesting. It's a good time for us to kind of share with a lot of the folks out there in healthcare and leadership the ways that we've been helping clients take care of a traditional old world problem, if you will, while setting the stage and leveraging some of these hotspots like generative AI and reducing burnout overall and making more of the resources that you have and becoming more optimized and efficient. Um, all stemming from a platform that we really started to deliver with a very small focus in mind in the HIM world, the medical documentation management world, and even go so far as I think the initial client that we worked with is they just wanted a better way to deal with all the internally coming e-faxes from external sources, if you will. So where we started that conversation a couple of years ago has almost allowed us the foundation to pivot into to the world where now we can utilize AI, machine learning, generative AI, to help automate not just those workflows on the medical document side and the medical document management side of it, but also setting the stage to just help automate a lot of workflows within healthcare and hospital organizations in general, with some of the foundational aspects that we've built. Okay. Um, so with that said, I think the agenda for the rest of the conversation around here, and I invite you guys all to ask some questions as we go. I think Steve and team will kind of flag me down, and I'll see some of the questions coming in too. And though we might kind of push them back to the end of the conversation, if I see one coming up that makes sense to broach or to talk about at that point in time, I'll go ahead and field it as they come. So I invite you all to keep it a little bit more of an open dialogue, if you will. But for the most part, I think over the next 35, 40 minutes, we'll walk you through this agenda that we have on the screen here. First, foremost, challenges associated with manual document processing. So some of the reasons why we are finding so much success with our clients and what we're able to help them overcome. Manual to automated, so steps in harnessing artificial intelligence and then even generative AI for effortless document processing. The generative AI use cases in IDP or intelligent document processing for healthcare. Unlocking the power of AI in healthcare document processing. What are the advantages of it and benefits? And then role of the data modernization in IDP, really getting to the crux of what we want for the future in data and information sharing as a whole, an interoperable idea throughout healthcare in general. And then HCTI's readable AI, a quick overview, if you will, of what our AI-powered solution for intelligent document processing is, and a couple of different ideas of how we were able to help clients and what we were able to help them achieve in that time and where we're developing it in the future as we go. So some of the key learning points, some of the reasons why we like to have these webinars in general is not just to push forward who we are as Healthcare Triangle, the partnership for healthcare leadership in progressive, innovative technological utilization of solutions to be more agile and efficient as an organization, which in simplified terms means, leveraging solutions to get better, not just trying to find a silver bullet where you buy it, plug it into place, think it's going to work for you. I think I had an interesting conversation at Chime about a month ago where a lot of the conversation was around, and I always drew the line and tied the line to superheroes. Ever since we were kids, we've always kind of had this ideal superhero in mind, whether it be Thor, Iron Man, Wonder Woman. The concept was, yeah, they were special in the fact that they had powers that other people didn't, but they also had implements or tools like Thor's hammer. We had Wonder Woman's golden lasso, and we had Iron Man's suit, if you will. Without those, they wouldn't be quite as effective as they are as superheroes. But the important thing to notice too is how good they were at utilizing those tools. It's almost like those tools were made for them, or they were able to leverage them as if they were just an extension of who they are as people, right? So meaning Wonder Woman probably couldn't put on the bodysuit of Iron Man and get the same results. Iron Man probably couldn't pick up Thor's hammer and get the same results, etc. So really finding out what that is in the core, what we would call competency in an organization, supporting that while helping to mitigate any of the things that the organization struggles or is challenged by. That's really the goal of true solution selling and really efficiency earning through utilization of the technology that you're investing in. And that's where we come in together. ideally, at its core, we're a consulting firm that helps select best size solutions and then actually get them to work in those organizations, if you will. Of which this is one of the solutions that we were able to offer some of our clients, and we continue to build a client base because of the uniqueness of what the solution is, even though at first glance it seems like it does a lot of things that are already out there in the market. So key learning for the webinar here is how AI and data modernization can streamline a lot of the document processing that might be happening manually or in combination hybrid, manual, slight modifications and automations, etc. Second key learning would be automating document handling with utilizing artificial intelligence and ML. I will also go so far as there's some use case for generative AI. It brings itself and offers itself a platform for safe utilization of Gen AI for efficiencies for hospital operations. Key learning number 3, data-driven insights for informed decision making. And then lastly, number 4, transforming document processing with readable AI. So I mentioned, resources were kind of minimal. Also, I think an interesting stat that I saw recently is since the turn of the century, I can say that now, since 2000, the idea of assistants and supporting roles and admins in healthcare and in healthcare operations declined about 40% in that over that period of time, to the tune of there's 1.6 less folks that are assisting and supporting the clinicians, even the professionals throughout the healthcare systems, right? And then we see from here, from this point in time into 10 years down the road, 2032, 2033, that will continue to decrease by another 10%, right? So I had mentioned that one of the hot topics that I keep hearing about is doing more with less. I think that really is important for the conversation of AI, generative AI, and that's really where a lot of those concepts are going to help hospitals and healthcare in the future. We need to figure out a way to leverage the solutions in a safe and efficient manner. AI and Gen AI really gives us the building blocks to do just that. It can assume and take on a lot of the burden and a lot of the roles and a lot of the duties that we traditionally have had in assistance and support roles in admin that we no longer have access to. 1 in 8 Americans are employed in healthcare, and so that seems like quite a bit of the population is in healthcare, yet we still have a shortage. We still hear that on an almost daily basis that we're trying to do more with less from a person power situation, right? Annals of Internal Medicine saying physicians spend average of 16 minutes and 14 seconds per encounter logging data into electronic health records, right? So that means to keep up with everything, even though HIT, EHRs, they made the promise of really streamlining and automating a lot of the processes for clinicians, and they have done so. There's still quite a big amount of time that they spend on updating documentation. A lot of times after hours, a lot of times it feeds and eats into family time for them or into the weekends, etc. So there's quite a bit of an opportunity to reduce some of that time and expense of time there as well. And then 4 in 10 Americans think that AI and health medicine would reduce the number of mistakes, but there's quite a large portion of them that would help. That think that it would also help with the efficiencies and effectiveness of the operations as well. And then lastly, an interesting statistic that I saw recently was 50% of medical errors in primary care stem from admin data entry errors and typos, right? So if we could take the human error equation or human error part out of the equation, we could see almost an instant 50% improvement in reduction of medical errors. And then lastly, the interesting concept here that I saw was, after all these years of going and building EHRs to which 96% of the hospitals are already fully contained and utilizing EHRs, they partner or they affiliate with organizations that are still faxing them information, right? This is a reality. It's almost like a sad truth that's sometimes laughable. We're still using fax for a lot of the interoperability that we've been trying to get through APIs, through HL7, through interoperability of data exchange, et cetera. So, and it says embarrassingly here, but yeah, the fact is a lot of the movement of information back and forth through the various different stakeholders and players in a healthcare network is still through either like real material paper and paper records, or basically the electronic equivalent, which is a static PDF or image file, which is they might send that paper through a scanner, create an electronic document, which is more of an image, if you will. Still no discrete data or information that they can use for research or understanding or even searching power. They're really just recreating paper on electronic form. The bulk of the information exchange is still based in that concept. So being able to break through that is almost a requirement to get to true digital modernization and digital transformation. So some of the challenges in manual documentation, and again, I had mentioned that we started down this road with this particular solution, focused on a very particular challenge that we were trying to help a client overcome. That was the bottlenecking of internal or incoming external e-faxes being sent into the medical records area of one of their hospitals in their operation, right? They had a handful, probably 6 or 7 people whose job it was to, as something came through a fax, it got printed out, they would scan it back in, they would convert it to a document, and then those people would be responsible for figuring out which patient in their whole EHR in their organization that this would be tied to, and if there was a way to index that so they could put it in the chart or the medical record in the appropriate place, that made it easier for not only the clinician, care provider, doctor, nurse to find that information to use it, but also anything for research or regulatory reporting needs or billing or anything like that on the back end to make it available for those folks as well. It became a very cumbersome process. They were finding that they were backlogged thousands of pages potentially at that point in time, right? So they needed a really good solution to help them cut that down and to reduce the time of processing. And that's really where we started with a solution. We were able to help them sniff out and figure out any internal coming or external incoming information, electronic documents that came in. We were able to help them run it through readable.ai and really cut that time down. So it really only presented to them um, areas that are gaps of information in that documentation or errors in that documentation, or if at the time it was they couldn't recognize it, if it needed to be rescanned, etc. It would present them to any of the outliers, if you will, while it would be able to recognize everything else that came in and automatically process it, really reducing, almost at the time it was about 80-85% efficiency gain just out of that process, and being able to speed that up with the efficiency. So that's where we started, and that was the major challenge of manual documentation at that point in time. But newer challenges that we're also able to overcome with the clients are increased risk errors, right? So anytime that you have human intervention, uh, there's going to be opportunity for risk or for error, excuse me, to present itself. Also, anything coming in as far as typos, missing information, incorrect data, um, you know, that's information that we want to be able to gather at that point. So making a patient safety bonus, if you will, to be able to enhance patient safety at this point was a challenge that we helped clients overcome as well, and actually help them to improve their patient safety with this solution. Lack of accessibility and collaboration, I think that kind of ties itself into, because of the inefficiency and the time consumption, we were finding that the information for some of the organizations that we work with, it was sitting in the backlog and it wasn't getting to the care providers in a timely basis where it was actually providing any value, right? It was critical information that they just couldn't get to the right people at the right time. Storage and retrieval challenges along the way. I think any time that you're dealing with manual documents, there's physical storage and space that it requires, as well as being able to find that. And do you have to go to a physical location and gather, or can you utilize the benefits of having a network and an EHR so that way you can access it anywhere that you have access to the EHR? That's a challenge as well for manual documentation. Compliance and regulatory issues. So not just the physical storage, it's also anytime that you have documents without proper management, you're presenting different risk and liability. Um, you also aren't able to check off some of the compliance issues that you need to have regulation over and governance over for your organization. So this helps our organizations really handle and manage the HIPAA related data information, lock it down, making sure that you have access where it's appropriate, but more importantly, that you don't have unauthorized access or inappropriate access to the data as well. That's always it's always a risk for you whenever it's kind of beware what you ask for. You have all this data and information, now you have to protect it. Limited scalability. This was a big one that we found late in the game that is really helping our clients change the game, if you will. They had a hard time bringing on new physical locations, whether it be physician offices or practices or physician groups or even different other hospitals that they want to pull into their network. Because not everybody has the same EHR, um, and they don't all have the same processes. It was becoming cumbersome and adding to that backlog again. A lot of times that EFAX was that lowest least common denominator, if you will, right? So everybody got back to the efaxing with the more people that they brought on, and that added to the pipeline in the actual buildup. And so limited scalability, these are things that really you don't really want to think about as you're trying to build and add on to your network as a healthcare organization, right? You want to have more interoperable. This becomes another channel for interoperability, which speaks to the next bullet item: integration with data systems. Uh, Manual document processing, it hinders the integration and interoperability with digital systems like EHRs, other healthcare applications, leading to data silos, reduce efficiencies, and leveraging technology for better patient care. There's truth to that. So this becomes another additional platform to allow for some more interoperability between physical locations in the network, et cetera, through the use of better transfer of data and getting it at least down to the digital aspect and presenting that again in the most appropriate manner to the users that need it. So there's a couple different steps in harnessing the artificial intelligence for effortless document processing. And when we first got started with the solution, it was a simple OCR, um, object character recognition. We put the piece of paper through it, and it would just pull it through, and it would identify certain areas that you would train it on. Now, with the transition to AI machine learning, we walk it through a couple different steps and phases that really helps for this concept of IDP and effortless document processing. So data collection, this I want to make note that there's a wealth of data information. I think maybe if we were having this conversation 10, 11 years ago, data collection was almost limited to just information in the EHR. So it was like getting EHR information in and out of itself, if you will, right? But now, because we're trying to do more for research, we're trying to do more for taking multiple factors into everything from being specific with how we treat particular patients through also adding in concepts like genomics and basically sets of data that has thousands plus of different data points that you have to consider that the human brain just can't process quickly by itself, leveraging some of that computer processing power, if you will. The data collection becomes almost the most important part of what it is that we set out to do with this. So we want to consume everything from data available through ASPs, Fire ASPs, non-Fire ASPs, HL7 integrations, et cetera. So it's the culmination of the actual data collection, getting it into the solution and making it available, tying on things like LLM for generative AI models, et cetera. And then the second step is, once you have all that data in there, is the model training, right? So especially training when we're dealing with generative AI, and I'll speak to some of the use cases for that in a few moments here. Um, training it on what's important, what's not important. It really acts as almost like the concepts of a human brain and how a human learns, minus maybe the emotional aspect, right? That's the next um, areas to actually try to utilize in artificial intelligence and try to speak for is the emotional concept of it all. But without the emotions out of there, it's basically data, understanding how to use the data, and then the continual perpetuation of learning based on additional data that you feed it. So that's the training in the healthcare specific context. And then the document creation itself, that's where you could provide prompts or specifications from the healthcare provider, if you will. Um, Maybe some of the documentation that they need, maybe some of the notes that they want to create and build into some of the EHR documentation that they're doing. Maybe they want to build different reports out of that. So getting the system to export and bring the data and export it into a format that's necessary for the end users. That's that document creation. The summarization, and this is interesting. This is really where we're spending a lot of our time now, and this is really where Gen AI is opening up new doors here. It's being able to extract key information, identify the important findings, and then really generate the actual summaries out of there on an accurate basis, right? And then being able to land that somewhere in so that the idea is a clinician, instead of searching through a bunch of different documents that might have been scanned or entered into the system, they can then now quickly see what's relevant to them, what's the summary, it's going to be accurate for them, and they can understand better, do they want to go and open this, or do they want to pass on it and find out some more information? Is it important for what they're dealing with at that point in time, or is it not important for them to use? That's that Gen AI introduced summarization of information. And then there's information extraction, and that's after you train the model, it can then recognize and figure out what the relevant data is, such as demographics, codes, treatment plans, perhaps, results, and then it can actually process those large volumes of documents in tune with all those different data points. So again, leveraging the computer power that a lot of times I talked to a couple physicians recently, and they were saying, hey, where we really see the benefit of Gen AI is not just helping us get past the writer block concept of how do I get a note started? How do I know that it's accurate and relevant to this particular patient? But probably more importantly, how do I get past any given time, even when I'm not tired, I can think of using 4 or 5 different factors in an equation as I get the strategy for how I'm going to plan for this particular patient. Um, how do I leverage computer technology to take into consideration thousands of different factors? And that's where they're starting to go with this concept. And that's where information extraction is going to be vital. And we're already seeing some gains there. And then lastly, document analysis. And that's based on medical specialties, identifying trends and patterns in patient data, performing sentiment analysis on patient feedback, or even analyzing scientific literature for drug discovery and treatment recommendations. So again, an advanced utilization and really pointing to being able to do more with less time, with less energy, and really using your data finally for which we're so heavily invested in after all these years. Backtrack here, apologize. So some of the use cases in IDP for artificial intelligence, and we spoke a little bit about this, but digging in a little bit more granularly, it's that medical imaging analysis. So where we're starting to see progress and where we're starting to help clients kind of pioneer into it are areas such as medical images, MRI scans, ultrasounds. These are things that come in. We can take a look at thousands of different examples and detect any abnormalities, bring that to the attention of the provider. Very similar to what a lot of radiologists are providing as far as, unbiased. Here's what the image is telling us. Identifying those patterns, not necessarily replacing a radiologist, but really arming them with let's not let anything slip through the cracks type of backup or safety net, if you will. Presenting that to them quickly so that way they can present that on to the clinicians and the providers as well. Synthetic data synthetic data generation. GenAI can also generate the synthetic data that resembles real patient data. So these are for areas such as research or anywhere that you need to de-identify information, but you still need it to be a realistic and accurate perspective of particular cases. Synthetic data generation is really where we see the future of trying to determine how certain care is going to affect a particular patient based on research in larger populations of data information, if you will. So that's going to help us in that regard. So that way we don't have to wait for 4,000 people to come in with the same symptoms. We can make assumptions on a much smaller population based on generative AI and how it will help us build that out. Personalized treatment plans. Again, this is kind of specific treatment for particular patients based on their information. And I had mentioned the factor concept, right? Any good physician might be able to take into consideration at any point 5, maybe even a dozen different factors at a time. They can't take on 3,000 factors. And I say this, there are some cases where probably that's the case, they can do that. But really, across the board, it's really being able to utilize that computer processing power to not just see what we've known and analyze trends on data based on unwell patients and patients that EHR has, which are a patient presents with a problem and they have a condition or an illness, et cetera. So we track that, but also on all the information, the potential of grabbing all their well information too, when they're healthy, when they're not in the hospital, when they're not populating an EHR, through the use of like maybe devices or Internet of Things or other tracking and health monitoring in general, right? We can start to bring that information into the fold through the use of AI, and that can give us a more holistic perspective and understanding of that particular patient, so we can prescribe them a more specific treatment plan, hopefully to better results and outcomes. Drug discovery, right? It's utilized to optimize drug discovery processing. It can generate novel molecular structures and predict their properties. It's identifying potential candidates of which different treatments might be more effective than others, or it can also help accelerate new treatments or research around providing better outcomes through new treatments and new solutions in the drug world. And then I think that last point is really important, right? It really helps to reduce and cut the cost out of that. I think it was interesting to hear in 2 different cases. I saw some very provocative presentations in the past 4 months where 2 different presenters had both mentioned that the biggest cost in healthcare to everyone, whether it be the patient or the healthcare organization or insurance companies, et cetera, was pharma drug costs and utilization there potentially, right? And a lot of that comes from some of the traditional costs of research. So I think by giving it a better jump start into a higher and bigger base of data information based on some predictions that we can model with utilizing generative AI, we could potentially reduce a lot of those research costs down over traditional methods, if you will. And then the disease progression modeling. And this is really interesting to me. Predicting disease outcomes based on the wealth of data information that the computer can take into consideration. This is where I see medicine really going. This, again, will help us line up appropriate measures, appropriate interventions, appropriate care plans in treatment, and even wellness strategies for particular patients in predicting better, more positive outcomes for different situations and scenarios. So unlocking the power of AI in healthcare for the document processing. So those are all the areas that we want to leverage the solution and the technologies that are available to us in healthcare. More specific to what we're doing with document processing in the solution that we have, readable.ai. Here's some instant benefits that we see with clients. First and foremost, the reduced manual effort and increased efficiency. That's that time that we had mentioned very first on. The enhanced accuracy, this is a critical factor too, that was almost like a positive side effect, if you will, to undergoing this solution. Is it didn't take us too long to realize that readable AI doesn't get tired. It doesn't get emotional. It doesn't go on break. It doesn't go home. It doesn't go eat somewhere. It doesn't come back and forget where it left off. It just continues to do the work without a lot of the different human concepts to hold it back, if you will. And at the end of the day, the enhanced accuracy is something that really provides a benefit to the concept of patient safety, and making sure that also we can get that information on a more timely basis to the appropriate people in a manner that they can actually utilize it for better outcomes. Right. And then faster access to documentation that segues right into that. That's really getting it out through the process and into the hands of the people that can best use it. Uh, that also offers us increased scalability. As I mentioned, depending on different organizations, what EHRs or processes or documentation they use for their own internal operations, as we plug them in and bring them into a larger healthcare network and try to interoperate that information, this helps reduce a little bit of that limitation by offering another platform, another manner for that interoperability and that data exchange, if you will. Reduce data breaches risk because we're doing it in more of a centralized area. We worked with a client where they did document management and document processing in multiple different locations spread out. And that included both electronic documents on machines that were physically there. It also included a lot of paper and a lot of paper records. So anytime you have a situation of that, it's like I try to make when you're trying to protect data, I like to use the old concept of we convert it to traditional storage methods, right? If you have a room, as soon as you put a door or a window in that room, that's a vulnerability. And then if you keep adding windows and doors to that room, different entry points, that's increasing your vulnerability. So, long story short, by reducing and centralizing this through readable AI, they minimize that points of vulnerability risk. And so there's reduced data breaches of risk. We provide it on public cloud of choice. It's very safe and effective in that regards. And then lastly, the cost effectiveness. Yes, there's cost associated with processing documents. By making it more efficient and by tying it in and by leveraging every single time you do that with readable AI, it learns and it gets just a little bit more efficient, just a little bit more accurate, just a little bit better, just a little bit cheaper each time around. The model that we have, it's extremely cost effective. It's not that we're replacing people, we're just making people more effective at a less costly rate. Role of data modernization in intelligent document processing. I mean, the role of data modernization, it's almost, it could be reversed. I think this intelligent document processing is one of the necessary requirements for true data modernization. We keep saying things like data modernization, digital transformation, digital modernization in healthcare, and yet we still have quite a bit of limitations that we have to try to work around. We're still probably 5 to 10 years away from true digital modernization throughout healthcare, just in generally speaking, right? But by implementing data modernization techniques, here's some of the gains that the hospital and healthcare organizations benefit and gain from it. Automate document processing, such as patient record management, insurance claims processing, and medical billing. So just making it a quicker process, again, more accurate, all the different benefits that we had in that last slide. We're accelerating the data retrieval process, again, supporting the clinical decision making, but also probably enhancing accuracy, improving patient safety, improving patient care. Leverage document analytics insights to drive process improvements, identify trends, and optimize operational workflows. This is probably the most important bullet for me. Back in the day, 15 years ago, I was trying to push people to use digital data information to make better decisions in healthcare, in operations, and on the clinical side, just using the data that you're so heavily investing in. That's the true point of undergoing this whole process of digital modernization, right? So getting to that, that's been a long time coming, and we're starting. A lot of organizations are doing it well. I don't think we're quite to the potential where we need to be in healthcare in general. So any step along the way that can help improve and cut out any of the inefficiencies leading up to that, for which this is certainly a solution for that. That's only going to benefit where we truly want to end up on this whole journey as a industry in healthcare in general. Enhancing data integration capabilities, allowing IDP systems to seamlessly connect with EHRs, promoting interoperability. So again, we keep talking about interoperability, exchanging data, digital back and forth between organizations, advent of FHIR, advent of APIs. Like, this is something that we supposedly have been doing for a decade or more. It's just starting to come to fruition now in all reality. Even some of the APIs that are available from the major EHR vendors, they're just finally getting to the point where we're interoperating outside of that particular type of EHR, if you will, or brand of EHR. So certainly have a lot of room for improvement as an industry in general, but I feel like the focus in the less resources that we have to work with are driving us to this quicker and more rapid pace. So let's get into readable AI. I do have a quick overview that I will share with you. Again, this is the platform from which we're starting. It was based on streamlining and making more efficient a eFax, an internal electronic document process, and getting that information available, accessible to the people that could best use it in an organization in the easiest manner, while gaining some efficiencies overall in patient safety, et cetera. We continue to leverage this for more and more, and our organizations are continuing to leverage this for more than just where we started out at the end of this. So let's get into it. It's an AI-powered solution that turns faxes, scanned documents, email attachments, and blocks of text into patient clinical information. It's doing the indexing, the routing, and the integration of the documents into the medical record. Okay? I think major EHRs works effectively with Epic, with Meditech. In essence, on a visual basis, it's the unstructured documents on the left in that blue box, sends it through readable. We do the IDP. We automate that. Anything that needs human intervention, we kick out to a workflow. We've reduced the actual work by now upwards of 90-95% over where we started. It was more, we reduced it by 80%. And it gets smarter and smarter and more accurate as we go because of the underlying AI machine learning.
Are you facing challenges categorizing and extracting patient and clinical information from faxes, PDFs, images, and scans? Despite today's technology, a trail of digitized paper records still follows patients as they move through the modern healthcare system, creating a large processing overhead and trapping critical information in unusable formats. Healthcare Triangle's Readable.ai helps reduce this burden and unlock key information. Here's how Readable.ai works. Readable.ai uses artificial intelligence and advanced natural language processing technology to perform smart document classification, patient matching, and data extraction. Documents are received through various sources, such as a fax, and ingested into Readable.ai automatically. Key information is identified and extracted, and the patient is matched to their medical record number in the EHR. Information is then made available to caregivers at the right time and the right place. Check it out for yourself. Visit us for a free demo.
That's an overview of Readable. Again, anybody that wants to follow up, if they're interested in finding out more, we can schedule a demo or we can have more of a conversation as well. Long story short, again, where we started this journey here was to help highly trained information specialists get better and more efficient at their job and do it more quickly. At the time, they were the ones that were actually manually verifying and processing faxes and electronic documentation. And then, in essence, really, there was a lot of backlog in getting the information out and through to the actual clinicians that needed the information. What it does at its foundation on the form side or the information document side is it extracts the relevant information, and then it will also check with the EHR, verify and connect the information, be able to identify which patient it should be tied to, which medical record, which intervention, which encounter, um, for future use and validation. And then it classifies them in the right order. Is it a patient? Is it an encounter? Is it order documents, et cetera? And then anything I mentioned, anything that outside of the standard, or if it can't do its job automatically, it will kick it out into a workflow for the folks in medical records to process. Again, reducing that overall workflow work list 95%. Query, what it does also on the interaction interoperability side of it is it queries that EHR for encounter order details. It can also upload it to the appropriate spot in the EHR EMR. In this instances where you're just getting new information for somebody that has not been into the walls of the organization from an outside affiliate or association, it can actually create the new patient in the EHR. So we have the features to do that. That's a relatively new development that we had a recent client say, hey, we would like to leverage this. We would want to see that it could help allow us to do that. So just an example of working with clients and being able to develop for that particular need in case. And then it interacts with EHR using APIs, HL7 messages, web services. Like if there's a part or a portion of data information that we need to get to, we have the ability to pull that into the mix and make that available through Readable as well. And then lastly, down at the bottom, I think a newer feature as well that's added a lot of efficiencies and operational gains for organizations is it allows to split and reprocess documents. So traditionally speaking, there's a lot of situations where this big stack of paper was converted into a very long electronic document that might have incorporated multiple different patients from different visits, from different order results, et cetera. It was literally a stack of this came in today, let's get a document, and let's get electronic, and then now what do we do with it? So they had to go through manually, page by page, and re-index it and reprocess it. Readable can do that automatically. You can set it up and make it more efficient and say, hey, this looks like a document, and this looks like it goes to this patient. And then that way the end user just verifies at that point. Makes it a lot easier. Some of the features, just to run down really quickly, we're kind of running out of time. I want to save a couple minutes for questions here. Automated document processing. So a lot of these documents now that went from minutes of processing is less than a minute with 99% accuracy as the system continues to learn your organization and how you deal with your forms. So that's reducing the effort by roughly 1/3. Categorization at ease. So it's able to automatically categorize over 90% of the different types of healthcare related documents. Compatible with major vendors, as I mentioned, Epic, Meditech, other major EHR vendors. Advanced document processing. Again, two-phase approach for extracting and verifying information, routing, and integration with hospital databases. Data enrichment and decision engines. This is document level content summary. So this is where generative AI comes into play. Again, it learns about the document, it reads it searches and kind of ties it back to the patient information. And then it can create and summarize that information. It can also create interactive questions, answers types of capabilities and collaboration. User interaction and ease of use. It allows Q&A at the document level for specific information, searches, enhancing user interaction, understanding. This is what we have the current and futures. This is a relatively new concept where at the user base, you can ask questions and it will give you answers utilizing generative AI based on the document and the information and the data that is in focus. And user experience, single sign-on, LDAP support, streamlined user experience. So it becomes transparent to the end user. Again, it just becomes that hammer for Thor, that golden lasso for Wonder Woman, just an extension of somebody to be able to get through things more efficiently, more accurately, and more effectively. Benefits: streamlines healthcare workflows, AI, ML, NLP capabilities, reduce labor requirements for document processing, and also allows you to tiptoe into AI utilization in a safe manner. Processes documents less than a minute. Seamlessly embedded readable AI within enterprise applications, so transparent to the end user. Outlook add-in for integration for mail and attachment intelligent processing. So here again, I mentioned that eFax is where we got our start. it's kind of developed out to all incoming information can now be processed through readable AI. Currently supports 54 categories in subcategories of applications. So med claims, fax records, results, referrals, orders, patient reg, discharge summaries, etc. Meets or exceeds security standards for handling protected health information. Document split functionality for processing multi-patient, multi-category documents, like I mentioned. Speech-to-text summarization on physician notes, transcription using learned language models, and then generative AI for interactive QA and summarization. Again, plugging in, that's the next phase for how we can get generative AI to help us parse information and bring forward the relevant information quicker and more accurately for us. With that said, I thank you for your time. Open it up for any additional questions. We have a couple minutes.
Yes, thank you very much, Damien, for all that great information. We do have a few questions, but before we jump in, just to remind everybody that this webinar is available on demand. You will see it available shortly after we close this webinar today. So first, I want to back up to when you shared some stats. There was a stat on the 50% medical errors and being attributed to administrative data entry. There was a question on the source there. There are many sources for this. You can respond, but there are many sources for this, but I'm going to share right now a link to the WHO monograph on administrative errors, and you'll find that stat in there. If you got anything to add, you can, but that should give people what they need for that statistic.
Thank you. That's wonderful. And again, I think that's there's a couple of different studies that have been done on that, and they're all very close to the 50%. So that's certainly a good source. Thank you for sharing that.
There are, and WHO cites a few of the studies, and there are many other studies out there. So that said, we can jump into some of the other questions. So number one, how do you map the data elements to the relevant fields in the EMR? Excuse me. For example, once you determine a document is a mammogram with certain results, how do you know which order to map it to, where to file the different result components, et cetera?
Yeah, so a lot of that AI helps us first detect, it ties it to a patient. It does a little bit of assumptive work, and we can help increase the accuracy through configuration and through training of it as well. So it kind of takes a point in time of when that is received, what it comes in, and there might be multiple dates, right? There might be a create date, there might be a transmission date, et cetera. So it will help determine and make the best case. If it can't accurately, quickly determine where it's supposed to fall, it kicks it to that work list, and then a little bit of human manual intervention on the med records part to make it tie and draw to that particular area of the EHR, if you will. But the categorization itself, that's part of implementation. We identify which different form types, which different subcategories that will make sense for that particular client, as well as locations on the feeding side of it, et cetera. So I hope that answers a little bit of that question for you.
Great. So let's move on. Are you limited to a single source for the electronic documents?
Yeah, no. As I may have mentioned before, obviously all the readily available FHIR APIs, non-FHIR APIs, HL7 interfaces, we can get information from that. So we can either attach and affix to particular platforms in the whole area of EHR and surrounding HIT. We can also point to specific folders or locations, multiple different sources. We had to make a multiple source. One of our clients is multi-org, and within those individual organizations, they have multiple sources of information as well. So yeah, and for what we don't have readily available, we are a dev company too, so we can create those integrations. Pretty much, I don't think we've found an area where we haven't been able to get information out of. Pending, we have collaboration and cooperation from whatever, if it's a third party involved, we would have to bridge that with our client to have those conversations and get that information out. In some cases, we don't even need that. We can go and figure it out too, but that certainly helps. That's really the only limiting factor is if we're blocked by the actual source itself.
Okay. And this next question, of course, is being asked all over healthcare and even outside of healthcare, but like in a general sense. But relative to healthcare, it's now your turn to offer up your opinion. What do you see as some of the dangers or risks in leveraging Gen AI in healthcare?
Yeah, so I mean, I think an irresponsible utilization of it, trying to replace things that shouldn't be replaced. So I think trying to replace the human mind and the human gatekeeping and decision making at this point of where AI is, I think that would be a huge risk. I think everybody, almost everybody agrees with me, right? Where I don't see a risk at this point is the whole. I get into a lot of conversation where people are they're almost scared of Rogue, the robots taking over, the Sentinels, right? I don't know that I'm really there yet. I think, as I mentioned before, there's another dimension that we haven't gotten to, which is the emotional aspect of it. I think without emotional intelligence, I don't think it can be a runaway technology at this point. We just have to make the best decisions as far as where is it best serving our industry and our users. Like, is it an extension of who they are, or is it trying to replace something that shouldn't be replaced? And then obviously accuracy. There is a bias that we're finding depending on source of information, such as the learned language models. Like if we pick ones that are biased, obviously we can run the risk of having biased answers for generative AI, especially. Um, but I mean, in reality, that's a human condition too, right? Like if we come up through a particular med school, like we'll be biased, right? In reality. So the I think I'm a little bit more open to that, though it's still probably a risk.
Okay, so AI robots won't be taking over anytime soon, but are you seeing organizations actually using AI to using these technologies to replace people?
No, I don't right now, and I'm glad I don't. I think again they're extensions, they're complements. Where I'm seeing a lot of organizations using them are, with us being more summative, being more able to find answers through questions and answers. Like you have a whole database of information. Like this is what's important to me. Can I leverage any of that to answer my question? And then it can tee that up. That's where I'm seeing them. And then the last case is like ambient listening devices for getting doctors and physicians back to their families at the end of the day. So they're and this is a hot topic too. I mentioned Meditech and Epic. I think they're probably one of the or two of the biggest EHR companies at this point. They have been for a while. Both of them in the past couple of days have had leaders like Helen Waters on Meditech side. Who was it? Somebody over on the Epic side had mentioned that Gen AI, they're both leveraging that and they're both embedding that in for everything for things like documenting, assistance in summarizing information and getting those notes in there. So reducing that physician's burden of getting something started. Also, like one may mention that it's almost more empathetic AI is sometimes because it's not tired. And like one example was like, "Hey, I noticed you were on holiday. I hope you're having a good time on your holiday. Here's your results." Whereas the provider was like, admittedly, he's like, "I wouldn't have done that. I would just give them the results." And then so there's a testament to that, right? They're both embedding them into their platforms and getting utilization out of it. Study something in the 70s, maybe 75, 77, 76% or something like that of reduction in after hours time utilized for physicians to document at the end of the day. I think that's huge. And they do that through the ambient listening. So they have like, I don't know if it's Alexa or something in the room. And now, great, now mine's going to turn on. It's something in the room is listening. So as they have conversations with other care providers in that place and that patient, it can recognize are these the right people? Are these, how many voices? Yes, these are critical to the conversation. And then it can add that to the generated summary that the provider then can look over, modify as needed, and then click and file, right? And okay. So just a dramatic increase in time right there.
Let's close out with a question because we're coming up on time, and you answered that one quite well. Let's close out with a question specifically on rateable AI. Does this work on a particular cloud? Is it tied to a particular cloud?
Yeah, it's not. It works on AWS, GCP, Azure, though, depending on your specific need, it works better in certain areas than others, but like that's a conversation, and a lot has to do with who that client or partner might be leveraging already, that they can maybe take advantage of volumes in pricing, et cetera, or more realistically, I don't know. That's a conversation we have. Happy to have it with you. What's the better fit for the organization? Obviously, we have our preferences for different scenarios, but yeah, willing to have that conversation. No limits though.
Perfect. And well, I'm sure there are lots of other questions that can be thrown your way on readable AI and just AI, Gen AI in general, all these technologies. But we thank you for providing us so much information today. We'd like to thank you, Damien, and Healthcare Triangle for helping us bring this content to our DHI audience, and thank our DHI audience for tuning in today. Again, this will be available on demand shortly. So thanks again, everyone.
Yeah, thank you. Hopefully, it was helpful, and hopefully I didn't ramble on too much. Happy to have any follow-up conversations. Anybody interested?
No, very good. Thank you. This concludes today's webinar. Have a great holiday, everyone.